www.healthcmi.com. Acupuncture continuing education online today. Acupuncture rivals steroid inhaler for COPD. This was published at healthcmi.com on September 9th, 2018. Click on news at healthcmi.com to take a look at the article. Acupuncture is an effective treatment modality for patients with COPD, chronic obstructive pulmonary disease, an inflammatory lung disease. So university researchers conducted a controlled clinical trial, and they compared it with a steroid inhaler that's also a bronchodilator, and both produced excellent results. Essentially, acupuncture as a monotherapy, as a standalone treatment, increased the forced expiratory volume of the lungs, forced vital capacity ratio, and the peak expiratory flow. So what that is saying is that acupuncture can not only symptomatically help patients feel better, which was measured with questionnaires and such and examinations during the study, but also the objective results indicate that the respiratory output was significantly greater after acupuncture, that it physically helps the patient's lungs, and it's confirmed with objective data. Of course, the steroid inhaler did a great job also, and they were similar. The peak expiratory flow volume was a little greater with the steroid inhaler. The steroid inhaler has the advantage of acting faster. It's very quick to help the patients. However, long-term use can have serious side effects. In fact, the one tested here can even be life-threatening at times, but the medication can also be helpful at other times, whereas acupuncture has the advantage of having a low adverse effect rate and does well with long-term results. So COPD is caused usually by tobacco smoking, exposure to fumes. This can be, for example, in the third world, exposure to a lot of cooking fumes where there's poor ventilation, things like that. Emphysema can lead to COPD, chronic bronchitis. Symptoms include coughing, excessive sputum, whether clear, white, yellow, or green, wheezing, chest tightness, and shortness of breath. And what's important here is that because this affects millions of people worldwide, acupuncture is now providing an alternative. And now that we know through research the specifics, and there is a great level of detail in this article, in this research, now that we know that acupuncture is effective, it is an ethical choice to promote acupuncture as a reasonable treatment option for patients with COPD. At the very least, the strategy would be to give people acupuncture if they're already taking a bronchodilator combined with steroid, and then see if the acupuncture is effective enough to wean them off of it. That is a more balanced approach. Again, no one is suggesting something radical where drugs are bad, acupuncture is good, this kind of simplistic thing, or acupuncture is bad, drugs are good. Rather, these people are suffering and they need answers. They need long-term solutions. What may realistically come into play is that for severe acute flare-ups, the drug inhalers may help to allow the patient to breathe again very quickly, but long-term acupuncture may prevent the need for the inhalers themselves. This is not uncommon in an acupuncture clinic. The detail of the research is helpful to licensed acupuncturists as well. It goes into the acupuncture points used and how they were used. To scientists, they can take a look at the data and how acupuncture benefits the respiratory system. So it's a helpful article at healthcmi.com. Again, it's entitled Acupuncture Rivals Steroid Inhaler for COPD. Visit www.healthcmi.com. Click on news and take a look at the article. Thank you for listening. If you liked our podcast today, go ahead and give us a nice review. We hope to hear from you. Thank you. www.healthcmi.com.